there's a lot of confusion or there's a lot of uncertainty about the best way to go about these cases. And it really does depend on what the underlying suspicion is, why that blood test result was done, what the physical examination is like. And a physical examination is so important. And also your feelings as an owner. ALT, ALKP, AST, GGT, it's a right alphabet soup. But today I'm going to decipher what liver enzymes actually are and what you should do if you find your dog's liver enzymes are raised.
Welcome to Call the Vet, the show that answers all your dog and cat questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
You're listening to episode number 49 of the Call the Vet show. And if we've not met before, then I'm Dr. Alex and I'm the veterinarian behind ourpetshealth.com. And my aim on this podcast is simply to answer any questions you have about your dog's health, about your cat's health, about what's going on with them if they're unwell, or about how to keep them as healthy as possible. So if you're new here, if you've not listened before, make sure you hit that subscribe button so you don't miss out on my future content. There's also 48 other episodes in the back catalogue to dive into. And if you are a regular listener, welcome back. I'm really pleased that you've chosen to spend time with me again, and I hope you're going to get some great value out of this, because I'm talking about a really common problem, and it's a really interesting problem in the sense that there's often no right or wrong answer, but it's also one that we as vets also struggle to know what to do with. So this is going to be my take on it. Your vet might have a different take. You as well might have a different take on it. And that's absolutely fine. But let's have that discussion. Let's see where we get to as I talk about liver enzymes today. But before I get into today's question, I wanted to bring you some exclusive news, and that's that I'm soon going to be launching the Our Pets Health member hub. So this is going to be the one place where you can get exclusive live streams, Q&A sessions with me. I'm going to include some courses there, some other downloadable resources that's going to, massively make a difference in how easy it is for you to keep track of your pet's health and let you know the best way to look after them. It's also going to include discounts as well as a community forum. So it's going to be really the one place where you can get everything you need, and there's going to be a lot of exclusive content there. So if that sounds like something that you're interested in, and I hope that you'll join me over there, you can join the waiting list to hear about launch specials and hear about other news over at ourpetshealth.com/member. And that link is also going to be in today's show notes. So let's jump into today's question, which was sent in by Bob. And Bob wrote in to say, my 12-year-old Beagle's liver blood test shows an ALT of 226, ALKP of 232, AST is 58, and GGT is 31. What should my next steps be? And so I've got to start this answer by explaining what that alphabet soup means. What are all these letters? What do they mean? How do they relate to the liver? And can they give us an indication of what actually the problem is? So let's start first. ALT, that is a liver enzyme that is released when the actual liver itself is damaged. So it's an enzyme that's contained within the liver. When the cells are damaged, this ALT is released into the blood and we can measure it. In a similar way, ALKP, or sometimes just known as ALP, is something that is related to bile stasis. So what happens is the liver, it processes the blood, it processes loads of stuff, it then produces bile in a number of different situations, and actually the ALKP is a marker of bile stasis, so when that bile isn't flowing as we would normally expect. Now that can be due to a number of different causes. Now, one thing to note that's really important with a lot of these other ones as well is that this is not as liver specific as ALT. It's much more sensitive to diseases outside of the liver, and certainly benign causes of elevation as well, meaning that it's actually not a problem. It's something that can be raised, but actually there's nothing that's causing that to be a sign of a problem being present. It's also released from other tissue as well, and the most important one here is a steroid induced form. So if your dog is receiving steroids for any reason, for any condition, then that can cause a raised ALKP. Also, if your dog is Cushingoid, if they have something known as hyperadrenocorticism, when the adrenal glands are producing more stress hormone than they should do. We can get a raised ALKP because that increased steroids causes this form to be released. Now, AST is a little bit like ALT, so the one I started with, which is a marker of liver damage, but AST is also found in muscle, so it's less specific than ALT, and it's often raised if there is also additional muscle damage. So it's actually frequently not measured, and it's not something that I tend to test very often at all because of that lack of specificity, and it's kind of a marker in comparison with ALT. Now, in different species, I think it's certainly in cattle, I think AST is a bit more useful than ALT, but we're talking about dogs here. And then moving on to GGT. Now, that's similar to the ALKP, a bile stasis enzyme, but again, it's less sensitive to liver disease, and so in the early stages, I guess, we may not be getting any raised GGT levels. Having said that, it is more specific, which means it is more likely to be related to a liver condition if it is raised, unlike that ALKP, which, like I said, has that steroid induced form. So that's quite a complicated kind of interaction between all of these different enzymes. And I guess what you really need to know is that they all relate in one way or another to a potential for an underlying liver condition, but they can also be affected by diseases outside of the body. And this is where a lot of problems come in when it comes to interpreting what elevations in these liver parameters mean and what to do if we get raised liver blood results, because we can end up doing an awful lot of invasive tests, a lot of complicated tests, a lot of expensive tests, and ultimately come to kind of a little bit of a blank conclusion unless we're jumping into liver biopsies, exploratory surgery, that kind of thing, which can obviously be pretty invasive, pretty expensive, and maybe detrimental to your pet depending on what else is going on. So that's all of kind of what those liver enzymes are. But what can cause raised blood results? So there's loads of potential causes, and unfortunately screening blood. So I don't know what the initial reason was that Bob's beagle was kind of had that blood test for, but screening bloods, unfortunately, they seldomly definitively diagnose the exact cause. So it's not going to be very often that your vet is going to be able to tell you exactly why those liver enzymes are raised. Now, they might have a very good idea, but more often than not, there's going to be an extra test involved, maybe a trial treatment that needs to be given, other investigations run to try and find out that exact cause. So sometimes increased serum liver enzyme activity occurs just because a patient does have a primary liver disease, so their disease is within the liver itself. But as I've mentioned, very often these raised liver blood results in dogs are often secondary to diseases outside of the liver. And to confound the results even more, actually tissues other than the liver also produce these enzymes. So I've already mentioned muscle, bone plays a bit of a role as well. So that's one reason why diseases outside of the liver, again, can cause an increase in these blood results. Now, it's also worth bearing in mind what the liver does, and that can help explain why it's so sensitive to different things outside of the body and why we get raised liver enzymes when actually there's nothing wrong with the liver. It's just doing the job it's been designed to do. So the liver plays a major role in the metabolism and excretion of drugs and other toxins that maybe come from outside of the body, but also that are produced normally by the body. So it's susceptible to injury from these toxins and also from diseases in other parts of the body. So we've already mentioned Cushing's disease, that hormonal abnormality where there's an increased level of the body's stress hormone cortisol, but dental disease will often cause increased liver parameters, other hormonal abnormalities, intestinal disease, pancreatic disease, so pancreatitis, intestinal disease being inflammatory bowel disease, even just a bit of a tummy upset can cause raised liver enzymes as well. And then the final complication is that increased liver enzyme activity, it can occur just because of a benign process. Now, the most common one here is going to be in older dogs. So they get a condition known as hepatic nodular hyperplasia. And basically what that means is you get benign nodules, so they're not cancerous. They're just a bit of an overgrowth, if you like, of normal liver cells that grow, and they just pump out a little bit more of the enzyme. Now, you're not going to get really high levels, a massive increase in the liver parameter enzymes in this case, but you're going to get a mild increase, and that then complicates the picture. What do we do with that mild increase? Do we just sit on it? Do we monitor it? Do we do lots of tests to see if there is something more serious underlying them, and maybe actually catching that early, which is going to be ideal with any disease? If we catch it earlier, we're more likely to be able to treat it successfully without it having a massive impact on your pet. And then jumping back into diseases of the liver itself. So if actually there is a disease within the liver, then there are also numerous different causes. So that can include infections, cancers, immune problems, other inflammatory conditions. So it's not simply as easy a case of identifying where that problem is. You then have to jump into more detail to say, well, the problem is within the liver, or likely to be within the liver, and how do we find out exactly what that problem is? Because there are a whole load of different conditions that can look very similar on other investigations, so other blood results and imaging and that kind of thing. So what should Bob do, or what should you do as well, if your dog's liver blood test results come back as high? So really the answer is that we don't treat blood results. That's the first thing. So I never just have a look at a blood test result and say, well, this is what we need to do, because we actually treat our patient as a whole. So we need to factor everything else in. Why were the blood test results run in the first place? What was the problem that was being investigated? Was there no problem at all, and it's just a bit of a screening test? So it really is going to depend on your dog. Also, what's the physical examination? Is your vet potentially concerned? Have they got an inkling about what could be causing the problem? Did they run that test to confirm that there was another disease present? Or are they investigating a specific symptom, a specific clinical sign that your dog is showing? So, a mild elevation in liver enzymes, it can be a sign of many things. And I've already mentioned dental disease, intestinal disease, just general inflammation, as well as liver diseases, of course. Now, mild elevation, as I've also always said, can be completely normal in an older dog, and it's really common. So that's why history is so important. Now, sometimes what we're going to do in the case of mild increases, we're going to simply recheck them in a few weeks to see if there's been any change. It might be that we're going to, carry out that dental that's been recommended for the last little while, because severe dental disease is absolutely going to be causing a mild increase. And if there's no other concerns in what your dog's doing, their appetite, their toileting, their weight, that kind of thing, then absolutely getting that done would be a good idea. It might be that we do other blood tests, so something called a bile acid stimulation test might be run, and that's a way to test actually what the function of the liver is doing, because if that's altered, then we know that actually the liver isn't working properly. So that's kind of confirmed that there is an actual problem. It might actually be that we do imaging of the liver, so that's often ultrasound, and that's definitely going to be the most accurate way to examine the structure of the liver itself, and as well kind of look at the other organs. So you can look at the pancreas, the intestines, the kidneys. X-rays can be beneficial, but really X-rays look at what the size of the liver is, and it's going to show up any big masses as well, but it's not very good, or it's impossible to see the actual structures within the liver. So the liver on an X-ray, it just looks like a homogeneous, a plain kind of grey structure, and it's not, you don't kind of see the little tiny details within the liver, which you get with ultrasound, which can be very, very useful. But the bottom line is that the liver is a very hard organ to know exactly what's going on. And in some cases, when everything, especially when everything points to a problem within the liver itself, a biopsy is going to be needed. And that can be done in a number of different ways. It can be done doing something called a fine needle aspirate, where a very small needle is under ultrasound guidance. So the ultrasound's used to kind of direct it to the spot that looks a little bit unusual, and a few cells are sucked up. It might be that a true cut biopsy is taken, and that again is a needle from the outside of the body going in under ultrasound guidance, but it's a much bigger needle. you get a much more useful sample, and it's much more likely that you're going to get an answer with that, but it's more invasive and there are some complications that you definitely need to be aware of. Bleeding is one of those because the liver has got a really, really good blood supply. Or alternatively, and probably the best biopsy that you're going to be able to achieve is going to be with exploratory surgery. So that's actually opening the abdomen of your dog so the vet can have a look and see what's going on. They can take a nice big sample, which is going to mean that a diagnosis is, not guaranteed, but is going to be as guaranteed as it can be. But also the other organs can be examined, maybe other biopsies can be taken as well. So, there's a whole load of different things, and it's impossible to give an exact answer of where, Bob should go with his dog, or where, the decision that you should make. Certainly if your dog is unwell, then we often can't afford to just sit to see what happens, to repeat the blood test results a few weeks later, to maybe trial a few minor treatments. If your dog is unwell, then they're going to need to be worked up to try and find out what that problem is much more aggressively than in a dog who is otherwise happy, is otherwise healthy, there's no other concerns with them, but a screening blood test, maybe a senior check, has just shown that those liver enzyme results are slightly high. So you can see with all of this that I've been talking about why there's a lot of confusion, or there's a lot of uncertainty about the best way to go about these cases. And it really does depend on what the underlying suspicion is, why that blood test result was done, what the physical examination is like. And a physical examination is so, so important. And also your feelings as an owner. What do you feel that you'd like to put your pet through? What kind of funds do you have available to you as well? Because if you're talking about biopsying and maybe referral to a specialist ultrasonographer, depending on what's available in your area, those costs can really add up as well, and that clearly needs to be factored in with any decision making. So to end kind of today's question, there's a bit of a follow-up from Bob. So after I'd kind of sent him back my thoughts, he kindly sent me back a follow-up. They saying that they did another scan and found that his gallbladder was enlarged and full of some sludge. So the liver scan itself came back as absolutely fine. So Bob's vet thinks that the gallbladder is pushing on the liver, creating the increase in enzymes. They have him on a few medications at the moment, and hopefully that will help remove the sludge. So that's really great news for Bob, great news for Bob's dog, because they've managed to rule out a lot of the more serious conditions, and hopefully some medication will sort out the problem and get everything back to normal and working properly.
Get your questions answered at callthevet.org.
Now, there's a lot to take on board with this topic. If you've got any questions, make sure you head over to the show notes and you can ask them there. You can also get me on Twitter is a good place to ask your questions. That's probably the place that I'm most active on. My handle is @OurPetsHealth. And also, if you've had a dog with raised liver enzymes, what's your experience been? Has it all been kind of passed off as nothing to worry about? Have you done rechecks? Have you done a lot of examinations to find out what that problem is? I'd be really interested to hear your take, because that also helps me as a vet to understand what owners want, what owners need, and what other information that they need, what you need to help you make the best decisions for your family. And that's it for today's episode. All that's left is for me to remind you to head over to ourpetshealth.com/member to join that waiting list for the upcoming member hub that's going to contain exclusive live streams, Q&A sessions with me, courses, resources, discounts, and a community forum. So I hope you'll find that very useful. I know you'll find that very useful if you join me, and I hope you'll join me to make it the number one place for pet owners just like yourselves to come to get the support they need to help their pets live as healthy and happy lives as possible. And I hope that you'll allow me to help you in more detail over there. But that's it from me. I'm Dr. Alex. This is the Call the Vet podcast. And until the next episode, take care.
You've been listening to Call the Vet. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show that answers all of your pet questions.